Hello, everyone. Good morning, good afternoon, or good evening, depends on what time zone you're calling in from. Thank you very much for tuning in for today's webinar. Today's topic is global humanitarian efforts during the COVID-19. Welcome, welcome. Thank you for joining us. My name is Rex Wong, and I'm the director of the Bill and Joyce Cummings Institute of Global Health at the University of Global Health Equity in Rwanda. I'm excited to host this event with a panel of amazing guests from around the globe. The Institute of Global Health was founded in 2015 as the very first department at UGHE, with the mission of providing high-quality education for all, conducting meaningful and applicable research to promote health, and developing communities by purposefully engaging with them, especially the vulnerable and marginalized populations. Currently, our UGHE flagship program, the Master of Science in Global Health Delivery, is housed within the Institute of Global Health. We have just had our commencement for our 6th cohort of students the past Sunday. So far, we have over 140 alumni in over 25 different countries around the world, fighting for social justice and promoting health as a human right. The new cohort of 52 students has just started 2 weeks ago, and many of them are calling in today to join this webinar. So today's discussion is chaired by Professor Agnes Binagwaho, the Vice Chancellor of our university. At UGHE, we actually call her Professor A. Professor A is a Rwandan pediatrician by training and has worked for nearly 20 years in Rwanda's public health sector, dedicating her life to improving the lives of people and instilling the principle of global health equity in her work. She has served Rwanda through a number of high-level government positions. First, as the Executive Secretary of Rwanda's National AIDS Control Commission, and then as the Permanent Secretary of the Ministry of Health. She later became the Minister of Health for 5 years before joining UGHE as the Vice Chancellor. She is also an adjunct clinical professor of pediatrics at the School of Medicine at Dartmouth University, is senior lecturer at the Department of Global Health and Social Medicine at Harvard Medical School, and a professor of pediatrics at UGHE, of course. Professor Binagwaho also served as a senior advisor to the Director General of the World Health Organization, a member of the United States National Academy of Medicine, and a fellow of the African Academy of Science. Thank you for chairing today's discussion, Professor A. Today, we also have 4 distinguished guests on our panel. We have Dr. Jamila Mahmood. Dr. Mahmood is a medical professional with more than 2 decades of experience managing crises in health, disaster, and conflicts. She is currently a professor and director of the newly established Sunway Center for Planetary Health in Malaysia. Her previous appointments included the Under-Secretary General for Partnership at the International Federation of Red Cross and Red Crescent Societies, Chief of the World Humanitarian Summit Secretariat at the United Nations, the Chief of the Humanitarian Response Branch at UNFPA. She is also the founder of Mercy, an international humanitarian organization in Malaysia. In 2020, just last year, she was appointed as the Senior Fellow of the Adrian R. Rockefeller Foundation Resilience Center. She is currently on the board of the Employees Provident Fund of Malaysia and the ALAM Foundation. Thank you for joining us. Our second guest is Dr. Jonathan Kabayan. Dr. Jonathan has 15 years of experience in public health, focused on primary health care, reproductive health, HIV, nutrition, health system strengthening, health policy development. He also works in emergency humanitarian coordination, research, and health leadership. He worked with different local and international organizations, including the Ministry of Health, USAID, AusAid, Global Health, COICA, and UNHCR. Dr. Jonathan holds a Bachelor of Science in Medical Technology, Doctor of Medicine, and a Master of International Public Health. He has rich experience in coordination and collaboration with different public health stakeholders at international, national, and subnational levels, in humanitarian emergency situations. We also have Dr. Sheila Davis joining us today. Dr. Davis is the CEO of Partners in Health, a non-profit social justice global health organization that brings the benefits of modern medical science to impoverished communities in 11 countries. With a staff over 19,000, PIH works to ensure that the universal human right to quality health care is realized. Dr. Davis has a long history of serving the poor and marginalized, starting with her work with the HIV and AIDS community back in the 1980s, both in the US and abroad. She was a clinician in the infectious disease clinic at Massachusetts General Hospital for over 15 years. And for the past decade, she has also held multiple cross-site roles in Partners in Health, including Chief of Ebola Response, Chief of Clinical Operations, and Chief Nursing Officer. Sheila, thank you for joining us. And our last speaker is Ms. Rita Amukubu. Ms. Amukubu has over 18 years of experience in the humanitarian field from the African Union and UNHCR. She is currently the acting head of Humanitarian Affairs Division at the African Union Commission, managing the humanitarian affairs programs and the free movement of person programs in Africa, coordinating with the AU member states, RECs, and humanitarian partners in Africa. She holds a Master in Public Administration from Open University in UK, a Master in Development Studies in Nairobi University, Kenya, and the third Master in Conflict Management from the University of Addis Ababa, Ethiopia. Thank you very much for being part of the panel. Now, without further delay, I'm inviting our Vice Chancellor, Professor Agnes Binagwahu, to take over the discussion. Thank you very much.
Thank you very much, Dr. Rex Wong, for the warm welcome to all of us and for hosting the webinar at the Bill and Joyce Cummings Institute of Global Health. I would like to give a very warm good morning, good afternoon, or good evening to you all, depending on where you are around the world, as attendees, experts, panelists, global health professionals, or global health enthusiasts. The monthly Ask Professor Agnes Equity webinar, which is a platform created to commemorate a UN World Day related to equity. This month, we want to raise awareness on the UN World Humanitarian Day. The theme of this year is Real Life Heroes. As inspired by this theme, our monthly webinar is entitled Global Humanitarian Efforts during COVID-19. We have invited as global health experts with whom we will discuss the global health threats and challenges in humanitarian field at the time of COVID. Rex has presented you with their bio, and you can see that there are really people who have a lot of experience, grounded experience. We are grateful for their acceptance to join us and very excited to learn from them. Since March 2020, due to COVID-19 pandemic, the life of displaced people already too often excluded from quality healthcare services has worsened. It is the case for millions of refugees that are currently residing in numerous camps worldwide where medical resources are already too little. For example, at the beginning of the pandemic, the Greek government was accused of negligence and risking migrants' life by the Human Rights Watch due to poor handling of refugee camps, where they put more than 37,000 people in facilities that could only hold 6,000, imposing a high risk of rapid contagion. On top of this overcrowded condition in the camp, one study has showed that this population of displaced people has 40% of adults with 2 or more non-communicable diseases. So poor hygiene and lack of medication to manage chronic diseases increase their risk to COVID-19 And the situation worsened dramatically by the fact that the ability to follow the World Health Organization public health recommendation, such as social distancing and hand hygiene and self-isolation, was and still is almost impossible to implement in this European refugee camp and in any refugee camp around the world. It is also expected that the number of displaced people will increase over 82 million by the end of 2020. This due to social, political crisis, wars, civil unrest, and climate change disaster. Moreover, food insecurity is on the rise in many countries that have become vulnerable due to natural disaster, conflict, and economic crisis. For example, we have more than 3.2 million refugees hosted in Ethiopia, Kenya, Sudan, South Sudan, and Tanzania, already facing reduced food rations because of underfunded. This is why we need to increase resources available to displaced people. For COVID-19, it's imperative that life-saving intervention like vaccines should be available to all people, especially internal displaced and refugees. However, it has not been the case during this pandemic. For example, despite the government of Lebanon adopting an inclusive approach toward vaccination, the refugees in that country still face issues to access the vaccination center because they have problems to overcome barriers to mobility. In March 2021, Rwanda was one of the first countries to include refugees in their national vaccination program as a priority group, given the risk of spread within the refugee camp because they were overcrowded. As of June 2021, 91 out of the 162 countries that UNHCR has been monitoring offer COVID-19 vaccine to refugees. If we do not act through coordinated effort in global assistance to support context-specific solutions in countries affected by humanitarian crisis, we have the risk that COVID-19 variant will ravage vulnerable population in this camp, but will spread out of the camp and threaten global health security. So let us discuss with our wonderful panelists what the situation is, what are the proposed situations to help address these adverse effects of the COVID-19 crisis for displaced people. Before starting, I have some logistical information to share with you to ensure access to people who have hard of hearing. Please access the closed captioning function at the bottom of your Zoom screen. You can access this by clicking on the closed captioning button to benefit from real-time subtitle. For people with visual impairment, our panelists has been prompted to be more descriptive in any image on the slide. Lastly, feel free to submit your question to any of us in the chat box for the live Q&A at the end of the presentation. Also note that all unanswered questions due to time will be answered within a week using Facebook, Twitter, or Instagram. Before we dive into the discussion, let me begin by asking each of the panelists to give their introductory remark. Join me in giving a warm welcome to Dr. Sheila Davis, who will be sharing with us today on the humanitarian role of NGOs during COVID-19 pandemic, an example in the United States. Dear Sheila, the world is yours.
My name is Sheila Davis, and I'm the CEO of Partners in Health, which is a social justice global health organization, and we currently work in 11 countries, including in the United States. Very pleased to be with you here today to talk about the role of NGOs in COVID-19 response. We know that globally, as well as in the US, that NGOs have targeted a number of key areas, including medications, vaccinations, food, personal protective equipment, awareness, and outreach. At the beginning of the COVID-19 pandemic, there was a huge outpouring to respond to the lack of supply of personal protective equipment globally, and many non-governmental organizations were responsible for rallying support, raising money, and also putting pressure on government forces to be able to release supplies of personal protective equipment, which has been very important to the response. NGOs play a very important role, but certainly have to be aligned with and working in coordination with government and other agencies so that there's not duplication of services, nor so that there is not confusion and chaos, which can ensue in any type of humanitarian response. In the United States, the response was very similar to what it was globally, and NGOs locally were instrumental in providing personal protective equipment and raising awareness to severe lack of supplies of PPE in many hospitals in the United States. Also, NGOs have been critical to providing social support, including food, access to food, and safe isolation and shelter. Partners in Health has been involved in working with, at the beginning of the response, up to 17 different places in the US in supporting response, including setting up contact tracing programs, to providing food, safe housing, and helping support what local and state governments were trying to do on their own. When we look at advocacy, another huge area where NGOs have been an important ally in raising awareness and putting pressure via education to many governmental people and different sections, so that we've been able to raise awareness to what has been happening and where there are certain gaps in what's happening in the US and what we need to do to supplement our public health system, which has not been invested in many years and is in many places is a weak public health response. Also, research NGOs have been important in raising money and raising awareness about the importance of research. And there are NGOs who are dedicated to funding and raising awareness of research throughout the United States. This was very true in the times of HIV and AIDS pandemic decades ago, and still many of those NGOs are still in existence, putting pressure to ensure that we have inclusive research being done. We also know that now with this trend of the Delta variant, that more and more research continues needed to be done to make sure that we are ensuring that there's access to vaccination for the communities that are most at risk. If we talk about best practices in the US, and Partners in Health works on an accompaniment model, which means that we work side by side with whether it's people, community-based organizations, faith-based organizations, or our government partners, to ensure that we are supplementing and being synergistic with their efforts and not creating parallel systems. The COVID response cascade in the US, in which we feel is best practices, has included community protection, testing, case investigation, contact tracing, supported isolation, and quarantine and vaccination. It's important that for all of this cascade to be effective, that there are the appropriate enablers in place. Enablers include a public health workforce development. We've advocated very strongly that we supplement and hire up to have a very strong public health workforce in the US, which is lacking. Data analytics and evaluation is a key part, an important piece of this cascade. Public policy and advocacy, community and social mobilization, leadership and government. In the US, there's a strong history of community-based organizations being very powerful and very able to get messages across to their communities, and are well placed to be ambassadors for vaccination, ambassadors for care within the US health system. We learned many of these things that we're doing in the US from our colleagues around the world, starting with our case investigation and contact tracing with drug-resistant TB, with cholera in Haiti, and with Ebola in West Africa. So when we look forward, we know that it's going to be important for for all of us to be implementing a cluster-focused response, which is something that we need to be doing more aggressively in the United States, and NGOs are playing a role with that in terms of care-based NGOs, as well as academic NGOs, which are providing much needed support, energy, intellect, and ability to move things forward. We pride ourselves in being very nimble and being able to adapt to help the current systems. So implementing a cluster-focused response really includes source investigation and looking for what is currently a current outbreak, testing widely for that outbreak, and doing aggressive contact tracing. Social support is an important piece of all of our public health efforts, and should be an important piece as well, is really looking at focusing on cluster response, and then really encouraging tactical vaccination. In the United States, we have abundance of vaccines available, but unfortunately are not having the same uptake in response for people being vaccinated as in other countries, unfortunately. But there are many really good efforts happening in Chicago, Montgomery, Alabama, and places like that to make sure that people have access to vaccines. Health system strengthening is a key component. The best place to be able to have healthcare access is when, and build healthcare access and trust in communities is not during an emergency. So certainly the efforts that are being done today, we're hoping are going to transition into long-term public health support, because that's the best way we can make sure that our most vulnerable communities are cared for. And advocacy is a big piece of that as well. I appreciate your attention and support today, and we certainly know that NGOs are a key component of any type of emergency response and any type of healthcare response in general. But the key for this definitely is coordination, alignment, and ensuring that the people who are on the ground, most closely proximal to the work that's being done, should have the most say in what's happening and what the response will look like. Thank you very much.
Thank you, Sheila, for an insightful presentation. Now, I would like to give a welcome to our second panelist, Dr. Jonathan Caribbean, who will be sharing with us the role of UNHCR during COVID-19 pandemic. Jonathan, the floor is yours.
Good morning or good afternoon. My name is Dr. Jonathan Caribbean, Public Health Officer for UNHCR in Rwanda. I'm honored to be part of this webinar and to be among the speakers. My big thanks to Professor Agnes for the invitation. My topic is the role of the UNHCR during the COVID-19 pandemic. There are more than 127 refugees in Rwanda as of 30th of June, that is spread across the refugee camps, transit centers, emergency transit mechanisms, and urban areas like Kigali. Refugees were not in any way exempted from being affected by the pandemic. A total of 1,303 cases of COVID were recorded from the refugee population, out of which 80% or 1,041 have recovered, and 20% or 255 persons remain as active cases, with 7 recorded deaths, which is 0.5% case fatality rate. While 556 were fully vaccinated, that account to 0.4% of the total refugee population. During the COVID-19 pandemic response, UNHCR has played different key roles, which include, among others, coordination with different partners working for refugees. Within the principle of the refugee coordination model, UNHCR and the government of Rwanda, the Ministry of Emergency Management, co-coordinate and provide leadership for the refugee response. Also, UNHCR leads the sectoral coordinations among the different sectors and participates in the national, subnational COVID-19 coordination. UNHCR advocates refugees' inclusion into the national policies, like the National COVID-19 Contingency Plan. It collaborates with the Ministry of Health, WHO, and other agencies in areas of assessment, research, and capacity building of health staffs. UNHCR also contributes resources to the government of Rwanda for the COVID-19 response and contributes on health system strengthening in the refugee hosting districts, including technical support. And UNHCR continues to deliver humanitarian services and assistance and protection for refugees amidst the pandemic. During the pandemic, there are some best practices that were achieved. To highlight some, but not limited to, uninterrupted delivery of basic humanitarian services, establishment of camp-based COVID-19 task force and rapid response teams across the camps, development and implementation of camp-based COVID-19 preparedness and response plans in all camps, establishments of COVID-19 treatment and quarantine facilities for refugees in coordination with the district authorities. While on the other hand, gaps and challenges remain that include social distancing in the camps, given the limited spaces, uncontrolled movement of refugees in and out the camps, dynamic and unpredictable decision-making, home-based care for mild COVID cases in the small, congested shelters in the camps, no standard management for quarantine facilities in the different refugee hosting districts, especially true during the early phase of the pandemic response. These challenges faced, actions and solutions are needed. Some recommendations are the following: continuous and effective coordination and collaborations with key agencies and partners, continuous engagement with district authorities, rigorous and appropriate risk communication and community engagement activities across the camps, camp lockdown if necessary, continue advocacy at different levels, also handling over the district the management of the treatment and quarantine facilities towards a more effective integration, rationally increase the capacity of healthcare workers and community health workers, including training. This ends my talk, and I'll be glad to answer questions from the participants. Thank you very much.
Thank you, Jonathan, for your remark on the role of UNHCR during COVID-19 crisis, taking the example of what is done by UNHCR in Rwanda. During the discussion, we will discuss more about what UNHCR is doing globally. Certainly because the relation and the achievement of UNHCR with the government of Rwanda are quite remarkable, and it's not always the case. Allow me now to welcome our third panelist, Dr. Jamila Mahmoud, who will be presenting the success and challenges in the promotion of humanitarian activities by national societies during COVID-19. Dear Jamila, the floor is yours.
Greetings, everyone, and thank you very much, Professor Agnes, for inviting me to say a few words. I speak to you from Malaysia, and I hope that everyone who's listening and participating, you and your families are in good health. And, I really do hope that everyone will have access to vaccines and we'll be able to get out of this surge in the pandemic as quickly as possible. In my country and in my region, we are really facing a large surge of cases, but I am certain that many people around the world are facing the same thing, especially because vaccine equity is not present and not everyone has access to vaccines. Nonetheless, I've been asked to share the experience of the national societies of the Red Cross and Red Crescent around the world in the management of this pandemic, and in fact, all other pandemics before it. The national societies are very special. They are auxiliary to government. They work alongside other civil society organizations, but also have legitimacy with their respective governments. Speaking from my previous role in the International Federation of the Red Cross and Red Crescent Societies, it's actually the volunteers, the 14 million volunteers around the world, that have been really playing a very important role in the community. We know that pandemics are really a very difficult situation to manage. And you may have the best facilities in the world, you may have access to vaccines, but the communities play a pivotal role. They have to understand that they need to comply to public health measures and that they hold the key and the solution to where pandemics not only start, but also end. And it is the work of volunteers of the Red Cross and Red Crescent societies that manage to convey this very strong message of advocacy, teach communities what to do. And it is because they are part of communities themselves that they have been successful most of the time in being able to influence communities to positive behavioral change. And this is really, really critical. So volunteers of the Red Cross and Red Crescent societies are really the real frontliners in communities, and we should all salute and thank them for their work. In many countries around the world, when the health systems are not as established, the Red Cross and Red Crescent societies play a very important role in all aspects, not just in terms of the public health measures that I mentioned, in terms of advocacy and communications, but also in terms of preparing communities, responding to the crisis by delivering medical and humanitarian assistance. But also in many countries around the world, it is the Red Cross and Red Crescent societies that are also delivering vaccines into people's arms. They're also transporting patients to hospitals and care facilities. And in many countries around the world, they're also responsible for the safe and dignified burial of patients. We've seen this in Ebola in the West African region, where it was the work of the volunteers of national societies that ended the pandemic, that really helped to break the chain of transmission. And they are doing exactly the same thing and trying to do exactly the same thing now with COVID-19. The big challenges we face around the world, and particularly for national societies, is really access to vaccines. I think that this is the biggest challenge, because while we have the mechanism through these volunteers and national societies to reach people as far as that last mile, but as close as urban settings, unless and until everyone has equal access to vaccines, we aren't able to protect many people around the world, and we aren't able to suppress the virus and bring this pandemic to a more manageable level. I think that moving forward, this pandemic will be here to stay. We think that there's many signs to show that it will be endemic, and therefore the sustained work of Red Cross and Red Crescent national societies is going to be very, very important in many countries, in all countries around the world. So on World Humanitarian Day, we salute so many of our humanitarian frontliners from the Red Cross and Red Crescent societies, from other organizations, from governments, from all aspects of society that have gone out there to serve humanity in any way that they can.
Thank you, Jamila, for your insight on the global image of the success and challenges of humanitarian activity by national societies that are really subsidiaries to helping the government to achieve their goal in this field. Last but not least, I would like to welcome our final panelist, Mrs. Rita Amukobu, who will present about the role of African Union during humanitarian crisis, taking the example of COVID-19 pandemic. Dear Rita, the floor is yours.
Thank you very much for that warm and very kind welcome. Good morning, good afternoon, good evening, all viewers, wherever you're joining us from. I'm pleased to make a presentation on the role of the African Union in humanitarian crisis in Africa. Africa is home to over 30 million forcibly displaced persons, namely refugees, asylum seekers, IDPs, and stateless persons in need of humanitarian assistance, most of whom are in protracted situations caused by, number one, conflict and terrorist insurgencies, such as the situation in East and North Horn of Africa region, the Sahel region, Lake Chad Basin, Cabo Delgado region in Mozambique. Number two, climate change and natural disasters induced humanitarian crises, such as the volcanic eruption in DR Congo, drought and famine in Eastern Horn of and West Africa region, cyclones and floodings in Southern region, and their effects on food security and livelihood. And number three, diseases and pandemics like Ebola and COVID-19. The effects of COVID-19, especially to displaced persons, has been very dire. COVID-19 brought vulnerability to displaced persons, especially displaced children, women, persons living with disabilities, the elderly, persons living with HIV and AIDS, and those suffering from chronic health problems. It also compounded the challenges of food shortage, disruption of their livelihoods, low nutrition, and limited access to essential facilities. It enhanced marginalization and discrimination, and refugees and IDPs living in crowded camps and settlements remain at risk to contract the disease, while others risk increased human rights abuses. Humanitarian delivery systems were interrupted, and weak social and economic safety nets that ensured survival for displaced persons were destroyed. What is the role of the African Union in humanitarian crisis? Number one, development of policies and normative framework, such as the 1969 Refugee Convention, which I'm sure many of you are aware of, the 2009 IDP Convention, and the 2016 Common African Position on Humanitarian Effectiveness, and the African Humanitarian Policy Framework, among many others. Number two, the African Union uses its convening power to mobilize member states, stakeholders, and resources needed. For example, the African Union deployed Africans to countries affected by Ebola, and it has also deployed people to support countries to fight COVID-19. It also established the Ebola Fund, and it was also established the COVID-19 Fund and the Special Emergency Assistance Fund, as well as the Refugee Fund. Number three, coordination with humanitarian actors. Number four, capacity building of AU member states and Africans in general on the continent to predict, to prevent, to intervene in humanitarian crises, as well as in post-conflict reconstruction. And above all, burden sharing and solidarity with affected countries. In fact, every year, the African Union sends a group of ambassadors who are members of the Permanent Representative Committee on Refugees and IDPs to countries affected with humanitarian crisis to offer them solidarity as well as financial support, a token amount for financial support. What are the challenges faced and what are the solutions? Number one is funding. I'm sure this funding gap is felt not only by the African Union, but by all of us who are dealing with humanitarian action in Africa, especially during this period of COVID-19, as resources have been diverted to fight against COVID-19. The African Union provides 2% of its overall budget to humanitarian assistance, but it has even decided to increase it from 2% to 4%. In 2011, the African Union held a pledging conference to fight against drought in the Horn of Africa region. And in November this year, 2021, African Union is going to hold a humanitarian summit and a pledging conference to mobilize resources for the Special Emergency Assistance Fund. African Union also advocates with member states and development partners for enhanced humanitarian financing. Number two challenge that we have faced is that the African Union is absent in the field. It is not in the field or on ground of the countries that are faced with humanitarian challenges. And therefore, the African Union has decided to establish the African Humanitarian Agency that will also have regional centers in East, West, Central, North, and Southern Africa region to ensure an even closer presence to countries affected by humanitarian crisis. The humanitarian agency will provide close coordination and collaboration with member states, regional economic communities, and humanitarian actors in Africa. And lastly, the African Union searches for durable solutions to the root causes of forcibly displacement in Africa, including conflict management through peacekeeping operations, conflict mediation, ceasefires, and creation of humanitarian corridors and conflict resolutions, such as peace agreements and peace support for peaceful elections. And it also makes sure discussing and negotiating with member states that the Sendai framework of action that is put in place to help deal with disasters is implemented at the national, regional, and continental level. Thank you very much for listening to me and for giving the African Union the opportunity to attend this very important webinar. Thank you.
Thank you, Rita, for this recall on the role of the African Union during humanitarian crisis, as it is not often enough emphasized and known. So I want to thank all our panelists for setting the stage of the discussion. And I remind the audience to send your question through the chat. And let us dive into the Q&A now. Because we have already some great questions. And remember, send your question, all the questions that will not be answered and will be in the chat at the end of the webinar will be answered within a week by the person the question is addressed to using the hashtag Ask Professor Agnes, and it will be answered on Twitter, Instagram, and Facebook, the three. So, dear Sheila, the first question concerns NGOs, so I will direct it to you. Some of the weakest points of humanitarianism are challenges to effective financial management, such as the sudden unexpected drop of assistance. What are the ongoing high-level reflections within NGOs of this during the pandemic? Can you share with us some reflection from your experience leading and working with partners in health?
Thank you, Dr. Inez. You know, I think that there's so many challenges, certainly, and the good thing about a humanitarian response, if there is one, is that it does motivate people to respond, and many NGOs and a lot of people give funding. The challenge to that is often that funding is used in a way that is not the most effective because it's done not in a coordinated way. So I think our premise always has been that really the health system strengthening, whether it's in a time of emergency or not, is the key to this. You know, a lot of the things you spoke of funding dropping off and that type of thing can be somewhat mitigated if the emergency funding is used with the dual purpose of helping build the health system. So for example, with oxygen during COVID-19, we've invested in oxygen plants that will not only address the short-term need for oxygen, but also have a longer term, there's ongoing needs for oxygen beyond COVID. So I think looking at the dual purposes of trying to make sure that the funding utilized is trying to build the health system. We also know that in the US, for example, we have a strong health system, but did not have a strong public health system. So we did not have strong contact tracing systems. Other countries such as Rwanda had a much more effective response than we did initially on COVID because there was a comprehensive public health response system. So part of this as well is utilizing the COVID-19 pandemic can we build up a public health system in the US to respond not just to COVID, but to the next thing that we know will be there. So I think the key components to me is looking at, we can't just address it as the emergency, but address it as what can we utilize this attention, this money, this effort to be building the stronger health system.
Thank you, Sheila. the solution is building resilient health system, and strong public health system in between crises is the solution. Thank you. Now, a question for you, dear Jonathan. Globally, do you think humanitarian organizations are more willing to work in their comfort zone instead of in conflict zone where aid is more required? And if so, how can we alter this?
Thank you, Professor Agnes. And as you can see, I am on my full gear. I'm in the middle of the refugee camp in Rwanda, doing supervising the nutrition survey. Yeah, I believe, Professor Agnes, that more humanitarian organizations are taking the path toward working in complex emergencies or in conflict zones because the need is higher, and so with funding opportunities. That's my belief. While I don't blame other organizations not taking the higher risk and remaining in their comfort zones, I also believe that time could come that they would struggle to thrive as opportunities and the funding are shifted to areas where the need is higher, like the conflict zones or emergency situations. But true humanitarian will always find himself to where the need is, and not in his comfort zone. Well, that's my personal answer. Over to you.
Thank you very much, Jonathan, for your answer. I now have a question for you, dear Jamila. We know that humanitarian efforts should be multilateral. How do you see the role of the private sector as an actor and partner in innovation for humanitarian work and disaster management? Jamila.
Thank you, Professor. What a good question that is. First of all, I'm going to say that I don't think necessarily humanitarian action has to be multilateral. I think that humanitarian action is always local and international actors come in to supplement. So I'm a huge fan of Partners in Health. So I think the model that Partners in Health has done has been incredible and I think should be replicated. Now, the private sector is already here. They are already becoming major players in humanitarian crises. And I think, but their role has changed. In the past, traditionally, humanitarian actors look at them as donors, providing resources and so on and so forth. But for the private sector, it is in their interest to work in this sector because of their own business continuity. And when countries or people are in crisis, they need to get them out because they need to get on and do their business as well. And I think where we have seen collaboration, it has worked. I come from Asia, and I can share with you, even in my country, we have something called the Corporations Disaster Relief Network, where they come together not just in terms of providing financing, but also the thinking and strategies that are required in large-scale operations. So, in terms of looking at fleet management, in the COVID crisis, for example, making sure that how do you build an oxygen plant on site at a very quick rate, and how do you bring the telcos on board to help with contact tracing and so on and so forth. So I think that globally we have seen United Nations, OCHA having this Connecting Business initiative, UNHCR, UN agencies have very, very strong partnership with private sector. We've seen the World Economic Forum take center stage on some of the most serious humanitarian crises. But I want to go back to what I said earlier about being local. It's also about local businesses in countries hit by crises that can also offer solutions and who may already have been involved in some form of business continuity planning or preparedness. And I think we need to work together to harness that as well.
Thank you, Jamila. Great points. The response is local and multi-sectorial, and the private sector is already an active player, not only with their finance, but by providing tools for the management of crisis. Dear Rita, the next question is for you. How can humanitarian efforts be most effective in delivering health services in conflict situations, where at least one of the parties do not recognize or is actively hostile to international humanitarian actors providing health aid?
Thank you. Thank you very much, Professor. Thank you for that very good question. I think here we are touching on the issue of international humanitarian law, which is the Geneva Conventions and the additional protocols, and I'll not go into those details, but basically to say that we are looking at laws of armed conflict and how but in terms of humanitarian response in such a situation, I think it is important that both state and non-state actors are brought into attention of the international humanitarian laws. They are trained and educated. But again, as you know, it is training and education is one thing, but respect of that knowledge and that information is another thing. So one, to begin with, also that training cannot be done in situation of conflict. It needs to be done in situation of peace. And therefore we need to expand our training facilities during the time of peace to ensure that people have the knowledge, have the information and understanding of what is required of them in situations of armed conflict. And I think there are many programs, including with universities, so that we are training the leaders of tomorrow, the decision makers of tomorrow, of the rules of engagement. But also, besides education, when it comes to actual humanitarian assistance and support in situations of conflict, again, humanitarian challenges are not, the solutions are not always humanitarian. So we would need to go outside humanitarianism and find people, mediators who have the skills and knowledge to mediate and to provide a conducive environment, because it is really not acceptable to send humanitarian actors in situations that are not peaceful or situations that are difficult that will cost their lives. Of course, the humanitarian workers and aid workers are ready. So what we would need is to get mediators who are acceptable by both sides, who can then mediate for humanitarian corridors, for setting up of humanitarian centers to allow some opportunity for, including humanitarian ceasefire, which is like 45 days, that would allow people, humanitarian aid workers, to go in and provide the support that is required. But even then, the protection of those humanitarian aid workers is very important. Therefore, that negotiation has to be done. Protection of civilians in that armed conflict has to be done. Protection of the humanitarian aid itself that is being provided has to be granted, as well as humanitarian centers or places where that relief is being conducted. And above all, the humanitarian aid workers themselves have to, to behave in a manner that would allow for the, respect of the humanitarian principles, which is humanity, neutrality, impartiality, and independence, especially when they are giving or doing their work in conflict situation. Thank you, Professor.
Thank you, Rita. You have reminded us that to protect vulnerable, displaced by any type of crisis, and also the humanitarian workers, prevention and training on existing laws and rights have to be done between crises. And during the crisis, a multi-sectoral approach to mediation to create a conducive environment is absolutely needed. Dear Rex, could you answer the following question? As humanitarian crises and refugees flows are multiplying in an unprecedented speed, could you share with us the critical importance role of higher education institutions have to play in informing and innovating solutions for those crises?
Thank you, Dr. Agnes. Education and humanitarian crisis. So I think the higher education institution, obviously the primary and traditional role is the education. But I think in modern days, particularly when we talk about education, we have to go beyond just teaching. There are a lot of immediate challenge when it comes to displaced people or emergency situation, food, shelter, healthcare, all these obvious choices. But oftentimes we forgot the critical role of education play, and that the benefit of education is well documented. It can impact the people's life in the future and introduce some of the common challenges and give insights to the best practice all through the higher education institution. So I think for education, higher education institutes, I probably would say it goes into 4 different areas. One is for the displaced people or the refugees or the people in crisis, providing inclusive and equitable education at all levels, from childhood to tertiary education or vocational training. All these are important. There are different ways to serve as tools for the successful incorporation of the refugees or the people into the society, reducing the risk of them being further marginalized. So that's important roles that we have to play. Now, I think a lot of higher education institutes are very accustomed to supporting students or scholars from other countries. But when it comes to the refugee or crisis situations, many universities still don't have a well-established mechanism to recognize their previous studies or the training or the degrees that they have. So oftentimes we just kind of push them aside. Whatever professional skills that these people have, we kind of do not recognize it. So I think higher education institutes can actually internally think about the policy and revisit it and see how we can actually incorporate them into it. Supporting the refugee in terms of funding, scholarship, language, cultural integration, all these are something university can do. As mentioned by one of our speakers, in crisis situations, the resources should not be wasted. And a lot of time humanitarian works, we're being criticized that not managing finances well. And I would probably expand a little bit more for our students and for our future humanitarian workers. I think as a university, we should give them practical competency and skills that are actually needed in the situations like that. Now, we're not talking about only teaching them, but also early exposure, giving them realistic and meaningful understanding of the crisis. Is not coming from the book or case studies. So skills like effective finance management, supply chain, all these are very important to be given to our students when they actually want to do this kind of work. I remember when I was a student back in the days when we were doing studying public health, every time when there's a crisis situation happening around the world, everybody, including myself, would volunteer to go. Not thinking about like, I actually have no skill involved. I have no skills, no competency, and I have no expertise in helping. And when I go there, I would just be another burden actually. But as a public health students, obviously we have the passion to do that. But passion is one thing, having the competency and the skill is a completely different issue. So as a higher education institute, I think we have the responsibility to give our students or future humanitarian workers the skills and the expertise. And I think the third part about education is educating the public. It is very important. So a lot of times, a lot of receiving countries have a hard time in accepting the refugees or displaced people. And a lot of time is because they do not understand the situation. And very often mass media only report the most sensational informations, not the most important news to the general public. And then resulting in the general public, they don't have a complete pictures. And this often leads to stigmatization or ignorance. So as a higher education institute, we should be the voice of the people and let the voice be known to the world, providing accurate information, whether it's from the perspective of historian, anthropologist, or journalist. Don't let the media dictate what the general public should know. And of course, telling the private corporation, bringing them into the picture is also another way to solicit financial and resources support. And a lot of organizations, just like one of our panelists mentioned already, private organizations can do a lot of things in terms of emergency situation. Maybe they don't have the expertise, but awareness is lacking. If they have the awareness and they want to do something, this is our job to bring the awareness to them. And I think the last part Higher Education Institute can do, play a role in situations like this is obviously research. Oftentimes organizations handling humanitarian crisis, they don't have the luxury to plan and do the most scientific studies because they have to do the work. This is where education institutes can come in, and I'm talking about research. They are actually having meaningful engagement that aims to provide real solutions to the community, not just like, oh, I just want to know something, that kind of things. So research that can actually generate some best practices that benefits the community, and those are the things that higher education institutions can help.
Thank you, Rex. So if I summarize, equitable, inclusive education, supporting displaced people in the country, and contribute by training our students in practical competency to transform their passion in effective management and educate the public, being the voice of the vulnerable, correct fake news, and do research to better, for doing better for the vulnerable people displaced. Very good program. Very good program. So, Sheila, could you answer this question? As we are nearly 2 years into the decade for action, can you share with us how humanitarian organization can best translate the vision of the 2020 Sustainable Development Goals into action within the remaining 8 years?
Thank you. A tough question. You know, I think I'm going to sound like a broken record, but I think it goes back towards investing in long-term efforts. The only way we're going to achieve the SDGs certainly is if the countries with the most resources are utilizing those resources in the best way forward by a plan that has been established by those who are in the most proximity. I think kind of a positive example, I think, of where we've made some progress is, unfortunately, Haiti just suffered another earthquake, as we all know, you know, over a week ago. And in the past earthquake, 2010, Partners in Health response was filling a plane with the US healthcare workers to go down and respond. This time, that was not our response because we had Haitian-trained clinicians who had been trained at the Mirabeau Hospital in Haiti, who have done emergency room residencies, who are ICU-trained nurses, who are surgical residents who had graduated. Those were the first responders. That's an example of the building and the long-term investment in education and capacity change the dynamic of this response in Haiti, certainly for our organization, which is one of the largest organizations in Haiti. So we are sending down clinicians, but they're serving as backup to backfill our frontline clinicians who are responding to the emergency. So I think if we approach the SDGs in a similar long-term investment in these systems that are going to far benefit, you know, beyond this you know, next 8-year gap and the next kind of set of SDGs. But I think we're not going to be able to do that unless we're really investing in these core capacities. And that's best defined by our Haitian colleagues, our Rwandan colleagues, et cetera. So I think what we need to do often is be really investing long-term, and in terms of educating our donor communities that actually one-off interventions are not effective, and we need to really be looking at how we are changing the system for the future.
Thank you, Sheila. So implement and planning by those who are doers and do action in proximity and build systems. Time to do that. Let us follow up a question with you, Jonathan. As we have noted, the humanitarian development divide is nothing new, and scholars have long argued that humanitarian assistance and socioeconomic development should complement each other to be more effective. Is the UNHCR partnering with different financial institutions to be more effective in its response?
Thank you, Professor Agnes, for the question, and I really like to answer it. First, UNHCR in its programming has incorporated long-term or sustainable development and partners with the different NGOs to implement such projects, construction of wash, health, school infrastructures, and livelihood programs or projects, and among others. Also, UNHCR works under the One UN umbrella and contributes to the United Nations Development Assistance Program to a country in order to facilitate and support its development, including the refugee hosting communities that would positively impact the lives of refugees. And lastly, UNHCR on its Global Compact on Refugees calls for international cooperation and support, not only in giving sanctuary to refugees, but sustaining and enhancing support to host governments and communities that have offered a home to large numbers of displaced people, while working towards integration or inclusion of refugees to the national systems like health, education, and socioeconomic sectors, and also expanding access to resettlement and complementary pathways. Of course, it depends on the context. Just for example, comparing South Sudan, where I have been for 10 months mission, I just came back, and Uganda, comparing South Sudan to Kigali or Rwanda. So there are different challenges in context, but these are the activities that UNHCR are initiating even in the start of emergency. Sustainable development and partnering with different NGOs.
Thank you, Jonathan. It's you put UNHCR at the center of the One UN approach and the connection with other key stakeholders in the country to reach that. Dear Jamila, there is a question for you. How do we ensure stronger local ownership of humanitarian action in conflict, as well as during health crises such as COVID-19 pandemic?
Well, we now have living proof, at least during the pandemic, that local action has been really pivotal in supporting the management of the pandemic. This is one of those crises where we don't have international actors flying in. And many of the local actors have risen to that challenge, and they have really been able to manage together with different local partners and the governments as well. So if anything, I think this should be not an excuse anymore for international actors to really relook at the model for future humanitarian assistance. In my last role in the UN, I was leading the World Humanitarian Summit, and you may have seen that the grand bargain emerged from that, where it is about a commitment from international actors, international donors, as well as international organizations to look at how can humanitarian assistance be more efficient. And one of those elements was about increasing investment in local action. And that means increased investment in capacities, a deliberate move to, some might say decolonize aid, to ensure that local leadership is key. It's not good enough to say you partner with local actors, but it's about who makes the decisions at the end of the day. Yeah. So let's call a spade a spade. It is really about power and how is power shared between international and local actors. I think if we look at the world today and the challenges we're going to face tomorrow, we will have no choice but to go increasingly local. And it's the right thing to do. It is in circumstances where there is sufficient capacity, or where even when there's not, if there's no access, we are obliged to support the capacity development of those people who are in the last mile in delivering assistance. So I want to, first of all, acknowledge that UNHCR has done a really tremendous job in this field. They have deliberately re-looked at their whole partnership model. I've been working closely with UNHCR when I was convener for the localization work stream, and a real commitment, not just talk, about shifting power, shifting funding, a deliberate move to capacity development, and so on and so forth. So I think, Prof, this is something that we as a broader community need to keep the pressure on. That this is something we can't take our foot off the pedal, because it really, we have to go as local as possible and as international as necessary.
Very well said, Jamila, that COVID was a catastrophe, but has shown that we have to decolonize, and it has obliged us to, because stop traveling, we have demonstrated that expertise, local expertise, are sometimes far better and far more adapted to local, and that we should not look always outside to get the response and the action. We better dig in ourselves and our capacity to implement them locally and immediately. COVID has shown that to us. That's true. My next question goes to you, Rita. What strategies does the African Union Commission have to meet any shortfalls in funding for ongoing and future humanitarian operations? And how can these avenues of funding be more durable for the African continent as we strive to achieve self-sufficiencies?
Thank you very much, Professor Agnes, or Professor A, as we have been told. I think this question touches on predictability and durability of humanitarian financing. And it's a huge challenge, but it's a challenge that has to be faced. We, as the African Union, yes, let me begin by saying that we acknowledge and really appreciate the support that is received from international partners, international development partners on humanitarian assistance in Africa. As you know, the needs are many. But we are also noticing as the needs increase, the funding is also dwindling, it's also reducing, and especially during this COVID-19, funding has been a big of a challenge, humanitarian funding. So the approach is that one, the African Union Commission wants to maintain the partnership and the relationship with all the international partners, the traditional partners that are already providing support. Number two, we also need to expand that bracket of the traditional partners, look for new partners whom we can work with to raise funding for humanitarian programming, including the private sector. I think Dr. Jamila already alluded to that, philanthropies, and there are many other resources and partners that we can partner with. Third, many governments are already putting in their resources. This is African governments Many are, and we need to continue that partnership and to even broaden it further. And I think this was expounded already when you look at the Global Compact on Refugees, and how to fund, especially from the government stream. And I think when we talk of governments and we want to look at predictability and durability, it will be helpful to ensure that such plans are integrated in national development plans and so forth. So expand that relationship with the African governments. Fourthly, we need to be creative and think out of the box and do business differently. If I take an example of the Kenya Red Cross, which is what I'm very familiar with, they have been able to raise money and behave like a private sector. In fact, like a business and entrepreneurial way of getting funding. They have been able to set up hotels and gain money from it. So we need to come up with more creative ways to make resources for humanitarian funding. But lastly, which is even more important, is we need to bridge the gap between relief and development. If we continue thinking, and when I say we, I mean humanitarian, if humanitarian planning and programming continues to be relief-based, then it's very short-term, and therefore the funding is also haphazard. So the planning has to be long-term. And in order to do that, we need to think as like development actors. And therefore, when we do that, we have more long-term planning and we have more predictability and durability of our plans. And no matter what we do, the situation in Africa is a protracted situation. So many people in Africa are displaced for several decades, yet the planning is short-term. So we need to have, there is a mismatch. You cannot be planning short-term for people who are in displacement for decades and decades. I think we are even at the level of the 5th decade. And yet the plan continues to be very, very short-term, relief-based. So we need to change this approach and enhance the link to development. And in that case, we even expand our partners to the developmental aspect of partnership. Thank you very much, Professor.
Thank you, Rita. Being more innovative, and this is also what COVID-19 has shown to all of us. There is question in the chat, notably du Sabamengo Ange de la Victoire. You ask a question about to me about so far, how do you rate the contribution of the University of Global Health Equity in responding to COVID emergency situation? What role have UGHE played in supporting the fight against the pandemic? We have done a lot, and I propose to answer to you through the other channel because it's not linked to the humanitarian crisis, but I will respond to you. There is a question here for you, Rex. How do you see humanitarian efforts making a real difference in education for children, youth, and adults in conflict, disaster, and forced displacement?
All right, thanks, Dr. A. So I think humanitarian work in many ways actually helped tremendously in situations like this because obviously they are the only organization actually helping people in displacing conflict. And during crisis situation, the first step is the provision. And a lot of humanitarian organizations, this kind of work actually provide exactly what they need: food, shelter, and a lot of times education. So I think a lot of time crisis situation, somehow they can last for years, and oftentimes we tend to forget it became a chronic situation. Humanitarian organizations and higher education institutions can help to transform and the situation or help the transition from managing acute crisis to addressing the chronic needs. So most of the children, when they're out of school for a long period of time, we will result in a lot of social problems, child marriage, gender-based violence, or just simply violence. And so for humanitarian work, having the creativity in maintaining the education, making sure that the children or the young people, they have the continuity in education, or the adults, they have the opportunity to learn some skills so that they can actually integrate it into the future society is very important. Empowering the women so that they don't subject themselves to all kinds of social disadvantage is also very important. Now, as mentioned before, helping them to integrate the new environment is important. And I think there's a whole field in education called education in emergency that is dedicated for this kind of work in the humanitarian work. Providing them like a safe space is not just for learning, it's also for healing and protection. So humanitarian work, we can collaborate with all these other different organizations, higher education institutions or private organizations to provide this kind of environment so that the healing, the protection can start. And that is important in terms of the future education as well as the integration to the community.
Thank you, Rex. There are other questions here, but our host, the chair of Bill and Joyce Cummings Institute of Global Health, Rex, has some question to ask you. So the floor is yours, Rex.
Okay. So first of all, thank you very much for spending time and joining our panel discussion. It's very exciting. And just looking at the chat box, there's so many questions coming up. That means this webinar is very successful and people are very interested in looking into this topic further. So I have a couple of questions for our panelists. So the questions I have for Rita, actually, because you mentioned we got to have some more creative ways for funding when it comes to humanitarian work. You mentioned about that. So can you elaborate a little bit, maybe give us a couple of suggestions how we can creatively get more funding?
Should I go right away?
Yeah, please.
Okay, thank you. Thank you very much for that question. I was actually borrowing leave from the Kenya Red Cross. And I don't know how many of us are familiar with that specific program. They have built hotels in different towns in Kenya. And their hotels are a little lower than the other hotels, but the service is very, very good. So they are always full. Even during this period of the pandemic, they were very full. So you see such an asset has been able to give them money, which they are using to do their humanitarian work. And in the hotels, they not only give services for normal hotel services, but also conferencing, and all humanitarian organizations actually go there to do their meetings, to do their conference facilities, to use those facilities and so forth. So in this case, they're not only asking from the public or from donors, but they are also creatively finding ways to make money. And this is what I'm saying. Can we think outside the box? Can we also be involved in legitimate businesses which do not take all our time away from our core work, which is humanitarian action, but at the same time are able to get us money to continue with the work that we are doing, especially in between when there is funding gaps. So these are some of the creativity I'm talking about. why don't we reach out to private sector? And as Dr. Jamila said, they have actually everything to benefit. But with the private sector, what are you offering them? You can't just be asking from them all the time. What are you offering? So can we think creatively and see what can we trade with the private sector so that they can be, interested, and not only to assist us financially out of philanthropic aspects, but also as a way for them to make money, or as a way for them to gain something being involved in humanitarianism. So I think we have a lot of opportunities. We have to just think a little bit creative. We must move from this idea of writing proposals and thinking, beyond that. How else can we gain and get money? Thank you.
Thank you very much. And I really like your hotel example. This is a great example and it's very solid. And I also really like the idea that you suggest we stop writing proposal, because I'm so sick of writing proposal every day. Great, thanks for the answer. I have another question for Dr. Jamila, and I really like your examples of like bringing the humanitarian response locally, because traditionally for the longest time, as far back as when I was going to school, when it comes to humanitarian work, we're always talking about international organizations going into the country and help the people, right? And that model is a little bit outdated, and I'm so glad you brought up the idea that we need to help ourselves to do the work, and because that's actually the more effective way. I was wondering, do you have any suggestions how you can transfer this local knowledge actually back to the global environment and tell people this is the approach to do, or instead of like writing all the cases from international perspective and coming in and put it in Malaysia, how we can use the local examples and tell the world, tell the global health arena that this is the best way to do.
Thank you very much. I want to give you a similar example and build on what was said by Rita. I happen to know Kenya Red Cross really, really well, and a huge admirer of them as well. Abbas Gulet was amazing. But that's the point. Why was it that Kenya Red Cross could just break out of the usual mold and do things like build a hotel, run a hospitality school, run the drone services for Kenya? Because it's about leadership. So when you invest in organizations, you need to invest in leadership as well. And that's an expensive investment, which means you have to deliberately find, the good leaders that you want to really take time to send them for, the best courses in management and leadership and so on and so forth. So I think that's one. The same thing with Kenya Red Cross. Let me share with you that when a couple of years ago, you would have remembered there was about 1 million refugees that actually ended up in Germany. And the German government and the German Red Cross were really overwhelmed. They had never had to deal with this large number of refugees. Kenya Red Cross became the mentor to German Red Cross. And actually the reverse mentoring approach, if you like to say, that they brought their local knowledge and their rich experience in managing crises to a Western, powerful economy. Because they had experience. So when people use the word capacity building, I kind of get hives, because I think it's a very demeaning power imbalance word. It's about mutual capacity sharing. There's a lot that local organizations, local governments can teach the more developed organizations and countries as well. So it's about how do you create that solidarity and that sharing that is useful for all. I can give you numerous examples. Similarly, when the impacts of climate change, and flooding and so forth, Bangladesh is giving advice to many countries in the West, because they've had to deal with so many of these catastrophes, and they've had so much experience with community engagement, getting people to go on bicycles and warn them of cyclones and so forth. But how then do you apply that in the Western agenda? Is it digital automation or whatever? But basically, there is plenty of room and opportunity for us to collaborate. I think leadership is key. A mindset shift is vital now. And I think that, you know, with a university like yours, University of Global Equity, Health Equity, I think it's so important to influence this younger generation that will be the leaders in the sector to completely, you know, reset, relook, and redesign that future of humanitarian assistance.
Great, thank you very much. And we need to talk about future collaboration to write some case studies about all the examples you all gave. Thank you very much. And for Dr. Jonathan, I do have a question. So now I mentioned that the university, part of our job is to have early exposure of our students to this kind of work, so that when they actually start working, it would not be complete foreign to them. They have the expertise, they have the skills, as well as the experience. So just from a selfish perspective, UGHE every year, we send our master students to do practical projects. That means they have to go out and do a research project with organizations like UNHCR or in the refugee camps. In the past couple of years, we have done quite a number of projects in those settings. And I would like to ask Dr. Jonathan, so looking forward, since you're also based in Rwanda, how can UGHE help you or your organizations to do better in terms of managing all this humanitarian crisis, as well as doing research in your setting?
Well, thank you, Rex, for that question, and it's very nice to answer as well, because in the past years, I was also engaged with your students. Just to say that we had some collaborations and research we have done in Kiziba camp, and we have that CAP survey we did on COVID-19 also, and also recently ongoing. And I was unfortunately I was in 10 months in South Sudan, and I was not really, but I'm in the communication, by the way, and students from UGHE are continuing to collaborate with us. And that I am very happy, actually, and I am always welcoming them because the research, this is one of the evidence based to inform us for our programming. You know, we are always talking about all these things, even globally, but we don't have enough evidence in the local or the camp-based level in Rwanda per se. And this will also include to contribute to the meager or very few evidence base for refugees setting globally. So I would say that we will continue collaborate, because as I agree that your students will, if they will come to the refugee camps and learn on the refugees and what is happening there, what are the issues and programs, and they can also explore which issues they want to research with, and we are welcoming those kind of activities and ideas, especially that these are the young people, and we really want to hear, we really want to see the evidence that out of these issues, and to inform us on our programming and also solutions that we have. And yeah, that's it. We're really thankful also to the UGHE for your continuous cooperation in approaching us on this one. This is in my behalf and also in the behalf of my colleagues in UNHCR.
Thank you. We're actually grateful that you allow our students to be in your camp. So just to have a time check, we only have a few minutes left. So maybe I can ask one last question to Dr. Sheila Davis, our CEO of PIH. It's a short question, but you can take as much time as you want, because it may not be an easy answer. So since you're the CEO of PIH, and then you also oversees UGHE, so I would like to see how you envision UGHE can position ourselves in supporting PIH international work, particularly in response to the humanitarian or emergency situations.
Yes, thank you. You know, I think UGHE has been the foundation of our academics, and I think has people from all of our care delivery sites have benefited from attending UGHE either as full-time students in the master's program or for a variety of the continuing ed. And I think, you know, the care delivery sites that we have around the world really is a constant you know, micro lab of what's happening and context of what kind of humanitarian response embedded in long-term health system strengthening, which is what we do. We're not an emergency organization, and we respond to emergencies where we are working and have long-term efforts. But I think UGHE can continue to be the educating of leaders, as was said so eloquently earlier, because that's really how we're going to change this kind of overall commitment to global health equity. And I think having a basis of education at a center like University of Global Health Equity will also allow us for that to be the convener. I think we don't need to have convenings in the US held by big academic institutions in the US. UGHE should be the global convener. It's well suited. It has the experts teaching. It's producing the experts who are providing global health delivery leadership around the world. So I think the onus is on us to position and continue to highlight what the university can do for global health delivery equity, not just within the 11 care delivery sites, but certainly far beyond that. And we're continuing to learn, and you know, our best synergy is when we have our community health worker from Malawi who feels part of this larger effort and feels part of the University of Global Health Equity. And the fact that the university has community health workers as faculty, as teaching about how to deliver care for the medical students to be learning from, et cetera, that's exactly what we want to promote. So I'm very excited about UGHE, and I think it's allowing our care delivery sites to really have a sense of being part of the future of preparing this next generation. So a very pivotal part of Partners in Health.
Great, thank you. So we only have a few minutes left, and I would like to invite.
Yes, thank you, Rex. Thank you, all of you. Thanks to our wonderful panelists and the participants for attending and contributing to this informative conversation, and for using this webinar as a platform for raising awareness about global humanitarian efforts and linked to the response to COVID and future threat to come. Dear speaker, we have all learned a lot from your knowledge and expertise. We must all understand that to follow your guidance, the humanitarian work needs to raise sustainable funds, as Rita said, be more local, as Jamila said, contribute and coordinate more with local stakeholders, and as Rex has demonstrated, universities are really there for that. So thank you, Rex, our chair of the Bill and Joyce Cummings Institute of Global Health, for hosting us. And if the participants want to learn more about the work of the Institute, please visit the UGHE webpage. The webinar recording will be disseminated on UGHE channel very shortly. And I remember that all your questions that you have asked now and has not been answered will be answered within a week with the hashtag Prof. Agnes on Twitter, Facebook, and Instagram. So again, Chela, Jamila, Jonathan, and Rita, thank you very much. You have really, it was very interesting. And thank you, Rex, again. And I call on you for next month's Ask Professor Agnes Equity webinar. Bye, everybody.
Bye, everyone. Thank you, everyone.
Thank you.
Yes,
bye.
Thank you.
Thank you very much. Bye.